Alzheimer's disease is not diabetes type 3. Who keeps saying that? Diabetes is diabetes. Alzheimer's disease is Alzheimer's disease. Now, diabetes that's not managed can certainly increase one's risk of developing Alzheimer's disease or a progressive type of dementia. But Alzheimer's disease is nothing new. It's been around since the early 1900s. In 1906, a German doctor by the name of Alzheimer was treating a patient that had language deficits, memory problems, erratic behaviors. And because he treated this patient, he examined her brain and found the amyloid plaque buildup. And so they named the disease after the doctor. Alzheimer's. Same thing with dementia with Lewy bodies. Lewy body was the doctor that treated a patient with those similar behaviors to include hallucinations, examined the patient's brain after they died, and found the asynuclein protein buildup. And so Alzheimer's is Alzheimer's, Lewy bodies is Lewy bodies, diabetes is diabetes. Now, again, if diabetes is not managed well, it will increase your risk of developing a progressive type of dementia. Diabetes is a metabolic condition. Alzheimer's is a neurocognitive condition. And so they're treated differently. But again, anything that affects overall cognitive functioning can put you at risk of developing Alzheimer's or a progressive type of dementia. When the doctor makes a diagnosis of Alzheimer's disease, several tests should have already been done, right? In addition to an informant questionnaire on cognitive decline. So that way the doctor can establish baseline information. Now there is a new blood test that can actually identify someone at risk for developing Alzheimer's disease, and it's a lot less intrusive than a PET scan and a spinal tap. Is it 100%? No, it's not 100%, but it is showing promise. It was approved by the FDA in May of this year. So Medicare does not cover it yet. Traditional insurance does not cover it yet, but hopefully they will cover it in the future. Right now, that test is costing anywhere from $500 to $1,000. Now, depending on the person's situation, they may get that blood test in addition to a PET scan. But several of you have talked about how that is catastrophic for your loved one to go and get a PET scan done because they're claustrophobic. It is very, very scary. The spinal tap is very, very scary. One wrong move, the person could be paralyzed. So this new Alzheimer's test is a way to get early detection done. It could be given and administered as early as 55 years of age. Now, just because you turn 55 doesn't mean you should go get the test, right? Because there's still false positives and false negatives. But if you are having concerns or your loved one is having concerns with memory and forgetfulness, you may want to get a blood test done to determine if the forgetfulness and the memory loss, the pervasive forgetfulness and memory loss could be associated with Alzheimer's disease or tied to Alzheimer's disease. And again, it's not 100%, but it is a really good way to detect a potential condition that's life-changing early enough so that way you can plan than to wait until later in the disease process when the medications that they have to treat the symptoms of the disease may no longer be effective. Now, there are 2 treatments on the market for those who are living with early stages of Alzheimer's disease or having early stages of cognitive impairment. It's not for later stages, it's for earlier stages. And it could potentially be a treatment to slow down the progression of the disease. It's not to cure it, it's not to prevent it, it's not to delay it. But if the person has been found to have mild cognitive impairment or early stage Alzheimer's, then there are 2 treatments that have been approved by FDA, and that's the Leqembi and the Kisunla, which is the donanemab. So the lecanemab and the donanemab. And again, those are treatments for individuals who have mild cognitive impairment or early stage Alzheimer's disease. The doctor has to be a willing participant in the process of diagnosing and treating. Medicare does pay for this treatment. Medicaid also pays for this treatment. So if you have Medicare, then Medicare will pay 80%, you would pay 20%. If you are duly eligible and you have Medicaid and Medicare, then you should pay nothing. Medicare will pay 80% and Medicaid will pick up the other 20%. So those are the only two treatments that have been approved by FDA that are on the market to treat early stage Alzheimer's or mild cognitive impairment.